tell you all a few facts about organ donation. Organ eye tissue transplant gives hope to thousands of people suffering from organ failure, blindness, bone defects, and burns. 104,748 U.S. patients are currently on the organ donation list. 4,000 new patients are added every month. Almost anyone from birth and beyond can donate their organs. Even with medical problems such as diabetes, hepatitis, cancer, asthma, and any other illnesses may donate their organs. A medical evaluation is done at the time of death to determine whether the individual can donate their organs. You may be asking yourself, how many lives can one organ donor save? More than 50 people can be helped through tissue donation. And then one organ donor can save up to 8 lives. I'd also like to tell you a few myths about organ donation. One is the rich and famous go to the top of the organ donor list. No factors such as age, gender, and income are considered. What is considered is your blood type, the length of time that you've been on the list, and how serious your illness is. Another is, can I have an open casket if I donate my organs? Yes, an incision is made, is closed, the dressing is put on, and you can never tell that the patient had donated their organs. If I agree to donate my organs, the hospital staff will not work as hard to save my life. This is not true. Medical care is based on what is necessary to save a patient's life. A patient can only be considered for donation if they have died or been declared brain dead. Organ donation is against my religion. Organ donation is okay in almost all religions. And last, I am under the age 18 and I am too young to make the decision. This is legally true, but your parents can authorize the donation if you wish. Now you may be asking yourself, what can be donated? Bone can be donated to help limb salvage, cancer treatment, spinal cord, and oral surgeries. Corneas can restore the sight to the visually impaired. Heart and heart valves are used in heart valve replacement surgery, which is usually used in infants. Your kidneys are used for end-stage kidney failure, and this eliminates the use of dialysis. Liver is donated to patients with end-stage liver disease. The lung as well. The pancreas is donated to diabetic patients that are on severe insulin dependency. This eliminates the need for insulin altogether. The skin is used on patients to cover severe burns, reduce pain, swelling, and scarring. Tendons are used to restore movement and mobility. Veins are used in heart bypass operations to restore blood flow. Small intestines are also used to treat intestinal failure to disease or trauma. How do you become an organ donor? There are 3 easy ways. The first and most common is to place a heart on your driver's license at the DMV. The second way is to register online at www.donatelifenc.org. Last, you can complete a paper enrollment and turn it in to Donate Life, North Carolina. Before closing, I would like to tell you an inspirational story about Jason Ray. Jason Ray was a mascot for UNC Chapel Hill. At 16, Jason Ray came home with a little heart on his driver's license. tragedy struck. Jason Ray was struck by a car in New Jersey with his team. He was declared brain dead, and his parents had to say their goodbyes, but he gave a new outlook on life to his donors. He gave a heart to a man that had been waiting 2 years. He gave a liver to a newlywed man who was second on the transplant list. He now gets to see his children grow up. He gave a kidney to a 16-year-old boy who is now playing basketball. Another received